Hey, well, good afternoon and happy St. Patrick's Day. My name is Senator Zach Duckworth, and I just want to thank you all for being here. I'd also like to thank Representatives Bahner and Morrison for being here and for their partnership, as well as the others up here joining us today. I want to start by emphasizing how much we love and appreciate our doctors, nurses, healthcare medical professionals, and providers, along with our pharmacists. The collective care these amazing and selfless members of our communities provide impacts every Minnesotan and their loved ones. Their good work, good deeds, and sometimes miracles have always been inspiring, and that sense of respect and admiration for this field of professionals has certainly been magnified over the last 2 years as we witnessed their seemingly limitless dedication firsthand. From the bottom of our hearts, Minnesotans, thank you for all that you've done and continue to do for those who we care about. Now, to the proposed legislation. Pharmacists have been an invaluable resource for patient care throughout the pandemic, and Minnesotans have come to rely on receiving everyday healthcare needs, from vaccinations to testing, at their local pharmacy. Access, choice, and affordable care is critical to Minnesotans, and that's why we're working in the legislature to strengthen pharmacy care in our state. I won't pretend to be a subject matter expert when it comes to the intricacies of every aspect of our healthcare system, but it doesn't take an expert to recognize common sense solutions and acknowledge successful best practices. If something has been proven to work and it can better the lives of Minnesotans, well, then it becomes incumbent upon us to pursue it, especially if it can save folks money, make care for their health needs more convenient, and greatly increase their access to care. That's what these three bills seek to do. Pharmacists are highly accessible healthcare professionals and provide critical health services to patients every day. Americans average living just 5 miles from their pharmacy and utilize their local pharmacy 18 times per year on average. We've learned some important and positive lessons as a result of the pandemic, and we should adapt to incorporate them so that pharmacists are able to continue providing essential services long after we've put COVID-19 behind us, to serve patients, improve accessibility, and lower healthcare costs. In 2020, the federal government recognized the vast resource pharmacists are in the fight to make sure Americans were vaccinated against COVID and other diseases. Pharmacists, pharmacy interns, and pharmacy techs provided more than 4 million COVID vaccinations in Minnesota. Under an emergency declaration in 2020, the Public Readiness and Emergency Preparedness Act, the Secretary of Health and Human Services provided pharmacists, pharmacy technicians, and pharmacy interns across America the authority to expand the pool of those who they could vaccinate with FDA-approved or approved for emergency use vaccines. Furthermore, they could order, administer, and interpret FDA-approved or approved for emergency use CLIA waive tests or non-laboratory testing like influenza, strep A, HIV, and A1C. In short, these bills ensure patients can easily and conveniently access immunizations and other services at their community pharmacy now and after the pandemic is over. They will allow for the screening and treatment process to be completed during a single visit, thereby improving access to care, counseling, and patient outcomes. I can tell you, as the dad of 3 little ones, I can enthusiastically let you know that my wife and I would be thrilled to utilize essentially a one-stop shop, so to speak, when it comes to routine or mundane tests or shots. I greatly respect the role of our pediatricians and nurses that they have regarding well-child visits. They've personally put me at ease with their expertise on several occasions regarding my kids. These bills are not intended to disrupt that process. In fact, they include language that encourages these checkups. And with that, I will turn it over to Representative Morrison. Thank you.
Thank you, Senator Duckworth, and good afternoon, everyone. Thank you for being here to talk about our bipartisan package of bills that will enhance patient health and access to essential pharmacy care. We've learned many lessons from the COVID-19 pandemic, and one that has certainly been reinforced is the essential role that community pharmacists play in the delivery of healthcare services. Patients throughout Minnesota became acutely aware of the important value of their local community pharmacist. Pharmacists are the health professional a majority of Minnesotans will see every month. They're providing critical health services to patients every day, and they should be able to continue to provide these services long after the pandemic is over. We need to act so that the essential services they have been providing so effectively can continue and expand. The bill I'm carrying with Senator Duckworth is House File 2768, And in its essence, it's a bill that enhances patient choice and improves access to care. The bill gives Minnesotans another option for access to the care they need by allowing pharmacists to administer subcutaneous and intramuscular injections with a prescription and allow them to help patients with external health monitoring devices. Pharmacists can currently provide medication administration and injection services for first doses, emergency situations, or when treating substance use disorders or mental illnesses. Pharmacies have proven to be a great place to rely on trusted, competent care that can be accessed in almost every community across the state. Whether it's administering injectable monoclonal antibody treatments for COVID-19 patients in St. Paul, or monthly mental health injectable medications in Detroit Lakes, or helping with multiple sclerosis patient injections in Worthington, pharmacists can provide these important medication administration services, saving patients time and money and helping them stay on top of the care they need. It will make care more convenient for patients, especially those who have trouble getting to a doctor, live in healthcare deserts, or have accessibility challenges due to their health or other issues. It will help reduce the strain on our healthcare system and improve adherence to critical medical care. So let's use the lessons learned from the pandemic to optimize and improve our healthcare system, improve health equity, make it easier for patients to follow their prescribed course of treatment, and therefore improve their health and allow pharmacists to do the job they can and are trained to do. As a physician myself, I understand how important every member of the healthcare team is, and I'm grateful for the essential expertise of my pharmacist colleagues. This is a win-win scenario for everyone, and I'm proud to support it. Thank you, and I will turn it over to Representative Bahner.
Thank you, Representative Morrison. Thank you, everyone, for being here today. First, I want to say thank you. I am the daughter of a nurse. I grew up next door to a pharmacist, and now one of my nieces is proudly joining the profession as well. So I really want to thank all of our doctors, our nurses, and our pharmacists for being on the front lines throughout the pandemic and all the incredible work that they have done. The bills today that you see are really about things like access and prevention. Having the ability to go to your trusted pharmacist in many small rural towns, even in the urban core in Minneapolis and St. Paul, the pharmacy is often the cornerstone of that community. It's where folks often see their pharmacist more often than they actually see their doctor. And folks during the pandemic especially have come to really rely on their local pharmacy to be able to access certain services and to be able to get the care that they need in a very quick and easy way. And I want to say that these bills are also about teamwork. It's about having the ability for pharmacies to work hand in hand with our doctors, our nurses, and our clinicians to provide the best continuity of care from end to end. One of the things that I have been following very closely is that during the pandemic, we've also seen a number of physicians talking about a real concern that we are getting behind on things like basic vaccinations. In order to catch up this backlog, we are going to need to be reliant on every member of that team from one end of the spectrum to the other to help care for that backlog, to get that preventative care out there and service our communities. So that's why things like payment for services are critical. We can't have our pharmacies surviving in our local communities if they don't get paid for the services they do. And I think that is just a common sense measure. So House File 4008 that I am carrying in the House really speaks to that payment for services model and how we ensure that even the pharmacies who are already registered to receive payment actually get paid consistently and reliably so that they can continue to do that good work and to be a part of that care team from one end of the spectrum to the next. And the other House file is House File 009. This is about immunizations and testing. Now, for the last 2 years, we have done a fantastic job, and pharmacies across the state have stepped up pharmacists and pharmacy techs have stepped up to help us with immunization and testing, and they have done so with great success. And really what this bill is about is making sure that we can continue that care even beyond the pandemic. And I think it's an essential piece that communities have come to rely on, and we want to be able to ensure that they still have access to those services within their communities from people that they trust at their local pharmacy. And so those are the main pieces of this bill today. So again, this is about access, it's about common sense, and it's about good preventative care and better outcomes for our patients. And we can do that even at lower and reduced costs to our system and to our patients. So thank you all for being here today and for taking up this very important topic. And with that, I will take our advocates.
Hi, my name is Mike Schwartzwald. My wife Laura and I are pharmacists, co-founders of Guide Point Pharmacy, which is a group of independently owned pharmacies throughout Minnesota, mostly in rural areas. We're here today to voice our support for Senator Duckworth, Representative Morrison, and Bahner, for they've authored these bills, and we're here today to let the public and legislators know that we need to pass these bills in order to continue to provide the health services from our community pharmacies that our patients have come to rely on. We've been pharmacists for 34 years, my wife and I, pharmacy owners for 21 years. We know that we have to provide enhanced services beyond just filling prescriptions and putting them in bottles to properly serve our patients and our communities. For instance, we have a telepharmacy in Longville. It is a town of a population of 153. The town cannot support a full-time pharmacist. There's only a pharmacist there one time a week, and I'm that pharmacist that's there. The demand is so great for immunizations that our waiting list has been up to 2 months long. During the pandemic, we administered over 900 vaccines to that location. Luckily, I had pharmacy students that could help assist, as I would have not been able to keep up on my own. Sorry, I'm nervous. We would love to be able to continue to provide vaccine services to more people in the area by having trained technicians co-administer vaccines beside me. This would allow more people to get the necessary services in a more timely fashion. I have also seen, especially during the pandemic, that there are many people with uncontrolled mental health illnesses. These patients could benefit from medications such as long-acting injectable antipsychotics, but there are not enough providers in the area to provide them. I can legally administer them, but have no way to get paid for those services, which is unfeasible. I don't make money on the medications, and I can't get paid for the administration, so it's an unsustainable service. I've given you a couple examples from my experience about how supporting these bills is critical for us to provide these enhanced services to our patients. Our fellow Guide Point co-owners also practice in rural areas, and if they could be here, they too would strongly support this legislation. Thank you for your time.
Good afternoon, everyone. My name is Dr. Tamara Bezdacek, and I have worked as a clinical pharmacist at mHealth Fairview for the past 16 years. I'm also the co-chair of the Minnesota Pharmacy Alliance, which represents all of pharmacy in Minnesota. I'm honored to be here to represent my profession and to formally thank our House and Senate authors for their support of the patient services access legislation that we're here to talk about today. And I'm also here today to encourage all legislators and the governor to support these bills. As you've heard, these bills will allow Minnesotans to receive a prescribed medication administered subcutaneous and/or intramuscular at their community pharmacy when appropriate. This is not something that we've been allowed to do up until this point outside of first doses and emergency medications. These bills will also allow pharmacists and pharmacy technicians to continue to immunize patients 3 years of age and older, and for Minnesotans to continue to receive non-laboratory health testing that they are seeking and currently receiving at their local pharmacy. Pharmacists would be able to more closely work with Minnesotans who may be at risk of contracting HIV to reduce the risk to near zero by prescribing HIV pre- and post-exposure medications. And finally, as Laura and Mike expressed, we have legislation that would help local pharmacies stay in businesses as critical access points of care in their communities. If the past 2 years have taught us anything, it's that access to health care is imperative to the well-being of Minnesotans. Unfortunately, many of my pharmacist colleagues across the state have had to shut their doors, especially in rural and underserved areas because of the current retail pharmacy economics. Pharmacists play a huge role in providing healthcare services during the pandemic, and if we continue to lose more pharmacies, we will leave Minnesotans with further reduced access to care that is so close to home. These 4 bipartisan bills will protect Minnesotans' access to pharmacy care, and we ask that legislators and policymakers support this legislation today. Thank you.
Anybody else have anything to add? No? Okay. I guess at this time, we would entertain a few questions if you have any.
Well, if you can help me understand, pharmacies have been giving vaccinations and doing testing for a long time, way before the pandemic. So what about it is this federal emergency law that's gonna expire? What changes after that? Why, just go back to the way it was before when pharmacies were doing vaccinations.
Sure. So in short, I'll try to answer to the best of my ability. Then if a real live medical professional wants to come up here and fix what I butchered, feel free. But the long and short of it is, it allows, first off, more folks who are qualified to give vaccinations at pharmacies to administer those vaccinations. It also expands or broadens the pool in terms of those who can get vaccinations from pharmacists. For example, I've got 3 kids. One's 6 and one's 4. Right now, my 6-year-old can go and get a vaccine there, and so can my 3-year-old. However, if we were to revert back to the laws that were in place before the federal law took effect as a result of the pandemic, well, my daughter Grace would be able to go get a vaccination or a flu shot, but my son Logan, who's 4, well, I'd have to do that somewhere else or take him to the doctor's office. And I can tell you, in the world of a parent, the ability to take both of my kids there and get them done in one stop would be a tremendous better use of our time, make our healthcare needs more convenient, and just makes a lot of sense. This law, the federal law that was put in place over the last couple of years to help us combat the pandemic, we learned that there are a lot of common sense measures in that law that should probably be permanent so that our pharmacies and pharmacists and their teams can continue to provide phenomenal care to folks in our local community. So if anybody else wants to add to that, feel free.
And were pharmacy techs and pharmacy interns not allowed to give vaccinations before the pandemic? That's right, okay.
Just do you want to chime in on that at all?
Techs were not.
An intern is technically a
That's correct. An intern can and a tech can't.
I want to expand upon that because the important part of the legislation, it does expand the folks who can administer the vaccines, but they're still under the supervision of the pharmacists. So that's an important and key component of the bill. They're still under the supervision of that licensed professional.
This might be a stupid question, but the federal government made this possible by changing this. I mean, does the federal government have to have some say in what happens going forward, or can the state make their own sort of policies around this?
It's my understanding that we can modify state law and have it take precedent over what's currently, when the federal law removes, it is no longer active, we revert to our state laws, right? At that point in time, we can change or modify them and make the changes that we're proposing and have them be long-term.
I'm curious if the pharmacist who spoke earlier could speak about what this reimbursement rate, sort of getting different reimbursement rates for pharmacists, what that could mean in terms of keeping pharmacies going in places like. And if you could say and spell your name too, that'd be really helpful.
Hi, my name is Laura Schwartzwald, and Schwartzwald is SCHWARTZWALD, and that was my husband Mike. As far as the reimbursements that he was referring to, he was talking about long-acting injectables for antipsychotics. We currently do not get reimbursed for the administration fee. When pharmacies run prescriptions like that through, it's something called online adjudication, and it goes according to a formula, and most community pharmacies don't receive actual profits on those types of medications. They basically are break even. So we could dispense the medication and give it to the provider who is going to administer the vaccine, or not the vaccine, the medication. But as he was stating, in Longville, which is a really rural area, and the roads along around Longville are pretty treacherous, especially in the wintertime. So trying to get in and out of that town is pretty dicey, especially this last winter. So he was stating that he would be able to give the administration of that antipsychotic medication, but we can't get reimbursed for the administration fee. So that pharmacy is already not doing well, and so it would be at further risk for sheltering or closing down. And that town is surviving largely because we have a small clinic and a pharmacy that work closely together, and so that we can serve the needs of the community.
Could a package like these bills help keep it afloat?
Absolutely.
So would this apply to injectables that just go into arms, or could it be the ones that go in the tummy or other places?
Yeah, so one of the examples that I think would be, a lot of people give themselves cyanocobalamin, which is vitamin B12. Some people don't like to give themselves shots. So that would be, I've been asked several times if I could give a shot to a patient because they just can't bear to give themselves a shot. So that would be an instance where we could potentially be paid for some of the services that we're providing. Another one that's really tricky for us is for long-term care providers, assisted living facilities. In order for the people in the assisted living facilities to actually work there, they have to get a TB test. And that's been cumbersome over the pandemic, trying to have access to get the TB testing. So they weren't able to hire some of the people in a timely fashion. One of the public health, actually the administrator from the public health in our community, Crow Wing County Public Health, had asked if we could provide those TB tests, and we can't right now. So that would have been another nice option for our community that I don't think it's kind of a balance between helping all the healthcare providers out instead of taking away from other people's, from one provider or another. It's everybody helping together for the patients.
We've got time for one more question.
Senator Duckworth, you mentioned this in your opening comments that the pediatricians may have some issues with this. What have you done to reach out to them and try to bring them on board?
Or so I've been told. Great question, and I wanted to, in my comments, specifically address that to let them know that we very much appreciate, respect, and understand the critical care they provide to our kids, especially those that are very young. I've got a 3-month-old at home right now. We're following up on his well visits and checkups very diligently, and based on the feedback we have received specific to well visits, we did include in the legislation in one of the bills specific language that says if we have minors coming into the pharmacies to receive this kind of care, the pharmacists will specifically let them know about well care visits, well child visits, encourage them, and let folks know just how important they are. So we are trying to underscore that, make sure people are still aware of them, encourage them, and not completely disregard them, because that is not the intent of this legislation by any means. We still want those visits to take place. I appreciate that question.
Thank you, everyone.
Thanks, everybody.